Those of us that are ready to learn more, let me just click my button there. So welcome to our seminar on cannabis use for symptom management in palliative care. Let me just get this to go here. So my name is Eloise Theisen. I'm an advanced practice nurse here at Stanford in the palliative care outpatient department. I've been working with cannabis patients for almost 10 years now, and in that time, I've seen over 8,500 patients who just want to use cannabis as a treatment for symptom relief. The majority of my patients are female. They've never used it before, and their average age is 76. So I get a lot of people who are what I call cannabis naive, and they're looking to use it for either pain or sleep, sometimes both, and they're often concerned about getting high or psychoactivity, and they don't want to smoke it. So I want to start out by introducing us to a partial list of conditions and diseases that cannabis might help treat. And this is a list that often will result in skepticism. Many people see this list and they think, how is it that one plant could be so effective at treating so many different things? And I promise I won't get too much into physics or biology or chemistry, but I do want to mention the endocannabinoid system. And this is the reason why we believe cannabis is so effective for so many different conditions. And the endocannabinoid system is a group of lipids, their receptors, enzymes, and neurons. And it's responsible for homeostasis, or what we call balance. And it helps to restore us back to balance when things become out of balance. And the endocannabinoid system maintains homeostasis for mood, appetite, sleep, pain sensation, and even memory. And we now know that the endocannabinoid system is found in all vertebrate animal and even some invertebrate animals. We have two receptors, CB1 and CB2. It stands for cannabinoid 1 and cannabinoid 2 receptors. And now we believe that our endocannabinoid receptors are the most common type of cell receptors in the body. And in fact, there are more endocannabinoid receptors than all other types of cell receptors combined. So this is pretty exciting. There are many different types of cannabis products, and these combination of cannabis products from the plant are called cannabinoid profiles. And I want to talk a little bit about what is in the plant to help you understand what might be helpful for you, what may be some of the risks and benefits of these treatments. I'm also going to talk about different ways that people can consume it. And then I'm going to talk about for which conditions we find cannabis to be the most effective. So THC is the most abundant cannabinoid in the cannabis plant, or what other people refer to as marijuana. This can produce an effect of euphoria. It can alter our behavior, our consciousness, our mood, even alleviate depression. And it binds to that CB1 receptor I mentioned just a couple slides ago, and that is what causes that psychoactive effect. It's a very potent anti-inflammatory, can also help with pain. And we found that THC can be effective for other things like nausea, appetite loss, sleep, anxiety, sleep apnea, post-traumatic stress, Tourette syndrome, and even some cancers. It is not a COX-1 or COX-2 inhibitor, and what that means is that it doesn't go through the same pathways as some of these anti-inflammatory medications that you might be taking over the counter or can no longer take because of the increased risk of bleeding. THC can help with the inflammation without those side effects from some of those medications. So some people use it as an alternative. It can produce side effects, and these side effects are dose dependent. So the more somebody consumes, the more likely they are to experience an adverse or unwanted effect. And while a lot of these words on the screen over here on the right are big medical terms, we might see increased heart rate, we might see increased appetite, we might see some dizziness, lowering of blood pressure. On the bottom, you'll see hallucinations, paranoia, amnesia, anxiety. That is often seen in larger dosages, and I'll talk about how to really control the dose so that you don't have these unwanted effects. Again, it's biphasic, so that means a low dose may be very helpful for nausea, but a large dose may actually cause someone to vomit. So if anybody's had an experience with THC that was unpleasant, it likely is because that dose was too high for them. So if we can keep that dose low, and often people don't need much when it comes to THC, we can avoid that anxiety, that quote unquote high that people are concerned about. And I want to spend a little bit of time focusing on CBD because CBD is promoted as, being a non-psychoactive cannabinoid, and I think they are putting it in everything. And there are some concerns about CBD in terms of its efficacy, in terms of how well it works, and potential side effects, as well as drug-to-drug interactions. Many people think that CBD is the medicinal part of the plant and that THC is recreational. But the truth is that all these different cannabinoids or molecules in the plant have therapeutic benefit. CBD is known as an antipsychotic, an anxiolytic, or an anti-anxiety, antidepressant. It is a mood-altering substance. It has been shown to treat more conditions than THC, so nausea, seizures, psychosis, inflammation, neurodegeneration, cancer, anxiety. Most of these studies have been done in animals and not in humans. So when we see some of these companies out there, and I'm going to talk about this in a few slides, that are promoting CBD for certain conditions, there's not necessarily enough evidence to back up some of these claims. So I really want people to take away from this talk is how to be a savvy CBD consumer if they decide to try it. It is well tolerated in very high dosages. We've given as much as 4,500 milligrams to humans, and they tolerated it well. One of the most side effects I see is dizziness. Occasionally I'll see some diarrhea, and in some cases some drowsiness or even sedation. We're more likely to see drug interactions with CBD than other cannabinoids, but often people are taking such low dosages of CBD and THC that drug interactions don't necessarily make a difference. And just like I mentioned with THC, that biphasic effect, it's the same thing with CBD. So low dose for some people can actually be stimulating. I have some people who have used CBD at night for sleep because that's what it was promoted for, and they actually found that they were awake all night. And I'm going to talk about that in a few slides. I want to talk about CBDA, which is one of the lesser known cannabinoids out there. And I mention this because it's now becoming more available to us as these hemp markets mature, and people can purchase CBD and CBDA online or over the counter in some stores. And CBDA is the raw form of CBD. And the reason this is important is that our bodies actually absorb CBDA better. And so less is more. You can take smaller dosages. It's not as expensive. You're not as likely to have adverse effects. And it's more powerful. So people who've tried CBD often give up on it because they don't see much relief. And that's likely because they have not gotten to the dose that they need to see the benefit. Whereas with CBDA, it can actually be quite powerful in the low dosages, and you might see quicker results. We haven't studied it as much as we have THC or CBD, excuse me, but we have seen it can help with some things like nausea, cancer, bacterial infections. In my own practice, I've seen it help with inflammation, pain, fatigue, ADHD, and even helping improve cognition. One of the other misconceptions out there is that CBD is often marketed as a non-psychoactive component of the plant. It is psychoactive, it's not euphoric. So it is unlikely to cause that quote unquote high that people are often concerned about. But it does alter our mood, and therefore we do need to consider this a psychoactive substance that can potentially have some side effects that I mentioned earlier, like dizziness or even drowsiness. So there's a lot of confusion out there right now around CBD, especially from the products that you can order online or through over the counter in some of these stores. And we now are able to take some CBD from hemp plants, as well as from the cannabis or marijuana plant. It's the same exact molecule. The hemp plant can flower, and so that's what we're seeing now is these companies are growing hemp plants that flower. In the past, we've used hemp for industrial purposes. The stalks and stems have been used for rope and textiles, concrete, paper. We want to really focus on the flower of the plant if we're going to use it for medicinal purposes. The reason that CBDA has become so popular and easily accessible is because the Farm Bill in 2018 descheduled hemp. So it actually removed it from the controlled substance list. However, the DEA and the FDA came out that same year and said, well, hemp is descheduled, but CBD is still considered a Schedule I drug, which means that we cannot prescribe that to our patients. Insurance won't cover it, and that the government believes that it is highly addictive and has no medicinal value. So there's a lot of gray areas here, but the bottom line is that CBD now can be sold widely all over the internet, and these products are not tested or regulated, and they may not be safe. They actually did an independent research back in 2017 to look at products that were being sold online or over the counter, and they found that 70% of these products were mislabeled. 43% had products that were underlabeled, so they had less CBD than was listed on the bottles. And 26% actually were overlabeled, and some had zero CBD whatsoever. The FDA does not require any regulation or testing of CBD at this point, but they will send warning letters to companies if they try to make any claims about CBD as being a cure for things like cancer. Or during the pandemic, there were CBD companies that were advertising CBD as the cure for the coronavirus. And so the FDA does send letters to these companies to require them to remove that language and not mislead consumers. So, like I mentioned, there's a lot of confusion when it comes to hemp and cannabis and the relationship between the two. So this, what you're seeing in the background here is actually the hemp plant that is the stalk and stem that's used, again, for industrial purposes. There's no flower on this plant. This is not something we should consider for medicinal purposes. This is a plant that looks like a marijuana plant, right? The only difference legally is that CBD from hemp has a THC content of 0.3% or less. And we now have growers that know how to do this so that they're within the legal limits. Again, you really want to look for products that are being advertised as flower-derived CBD. It should not come from a hemp plant that looks like this. And there are 3 types of CBD products from hemp that are being marketed to consumers right now. We have what's called full spectrum. So what they do is they take that plant in that last picture, the flowering plant, and they remove the oils from it, and they don't do anything else to it. So you have all the CBD and other cannabinoids and THC in that plant. These will have levels of THC that can be higher than some people are used to. So that THC level can go up and can cause some impairment. If you're concerned about using THC because of the side effects or for drug testing or whatever reason, you might want to consider what's called a broad spectrum, where they've actually taken the plant and they've removed the THC from it. There's also what's called isolate, CBD isolate, and that means they've removed everything down to just the single molecule of CBD. The research, while it's still sparse and mostly theoretical, does point to full spectrum products working better than a broad spectrum or an isolate because of the way that these molecules interact with that endocannabinoid system that I mentioned early on. It really does allow the cannabinoids to reach those receptors and produce a much more effective response when it comes to things like pain, anxiety, and sleep. So for me, if I'm going to be recommending a CBD product, I often will start with a full spectrum unless that is contraindicated for a reason. And because these products are not tested or regulated, I'm personally really passionate about making sure that these companies, that if I'm going to recommend one, has done independent third-party testing on their products so that we know how much CBD and THC is in there. I want to make sure they're not using any harmful chemicals when they're extracting this plant, because they can use things like acetone and other solvents that I think can be, over time harmful to the body. And just because I'm a purist, I like high resin cannabis, hemp grown sustainably and organically for the environment. I do recommend that people avoid products with toxic additives, so corn syrup or artificial flavors. It's not necessary. The hemp plant, even the marijuana plant, it's a very earthy tasting plant, so some people don't like the way that it tastes, but you can find products now that have natural flavoring in it to help with that. Again, make sure there's no illicit, explicit health claims around curing cancer or diabetes or other things that some of these companies say. And make sure it's being derived from the flower and not the seed or stalk. And while this isn't as much of an issue as it was when hemp CBD first came out, there are multi-level marketing companies where they want you to purchase large amounts of their product to try to sell to your friends, best friends, cousins, sister, and so on, right? These sort of pyramid ideas. And honestly, I think you can get CBD hemp now fairly reasonably with good discounts, and you don't need to sign up for that to try to help save money. Okay, so I want to talk a little bit about different routes of administration and how it can benefit people. The most common route of administration is still inhaled, and this is the route that most people are reticent to try, and with understanding. It does seem counterintuitive to recommend or try something that you're going to quote unquote smoke or inhale, but it is very quick acting. So in some cases, the benefit may outweigh the risk for patients in the short term because it enters the body through the capillaries almost instantly. People can feel their effects within 5 minutes, so they know whether or not it works. And it can be easy for them to repeat it if they need to. It doesn't last very long though, so it's not good for chronic conditions. It might be good for an acute need, such as extreme vomiting that can't be stopped with anything. This is what you see here called a pre-roll or a joint, and this is the cannabis flower next to it. And again, people tend to gravitate towards this because it produces a rich and nuanced therapeutic effect. This is what's called a vape pen. Some people refer to it as a wax pen. This has the cannabis oil in here that has been removed from the plant and concentrated into a cartridge, where you have often a battery that can either have a button to turn it off or on. Vaporization is thought to be safer because it doesn't heat the plant material to the point of combustion, which would release carcinogens and tars. However, these vape pen cartridges, batteries are not regulated either and can burn hot enough to the point of combustion. So the jury's still really out in terms of whether or not these are any safer. There's also concerns that inside here, you can see there's some metal inside this cartridge, and after anywhere from 3 months or more, these metals will start to leak in the oil and increase the amount of metals that can be found in the oil, which again, over time may be harmful to people who are inhaling. There's also some companies that will put additives in here like propylene glycol or polyethylene glycol because that decreases the thickness or viscosity and allows people to take a bigger inhale in. Most of the companies in California are not putting any additives into their products. But again, inhalation, the benefit really has to outweigh the risk because we know that long-term heavy smoking can lead to chronic bronchitis and airway inflammation and may be contraindicated in people with certain conditions. One of the more popular ways that people consume cannabis, especially if they're new to it, is through a liquid extract, often referred to as a tincture or an oil. And these are great ways to really control your dose because you can start low and slow with just a couple of drops. These products are often recommended to be put in the mouth underneath the tongue, which there's no harm in that. But I can tell you after years of doing this, I don't see any benefit to that because it doesn't tend to increase the amount of absorption or onset that people get. These are usually oil-based, and it can take sometimes an hour before people feel the effects of these tinctures or oils. They don't absorb well in the mouth. People often swallow them, and then it follows the pattern of ingestion, which means, again, anywhere from 60 minutes to 2 hours for onset. Duration can be 4 to 6 hours, so it is good for people who have more chronic conditions that they're trying to manage, like insomnia, chronic pain, or chronic nausea. Edibles are the most popular items available to us in dispensaries, which is where these products are sold in the state of California if the THC level is higher than the hemp definition. Edibles are not my favorite to use in a new user because they can be difficult to regulate the dose. Many of these edibles can come in dosages that are higher than I want somebody to start with. And the onset can vary in terms of when they take it. So for example, if you take any kind of cannabis tincture or edible on an empty stomach, it may work quicker, but you might have a much stronger effect. Whereas if you take it with food, it may take a little longer to take effect, but you'll have a much more even, consistent effect because the food helps your body absorb the dose better. Edibles can be problematic because they often taste really good, and some people may not know that there's a delayed time before they're going to feel it, and they may repeat their dose, which can often mean that they overconsume. And now we're back to some of those slides in the beginning where you have those dosages that can cause people to feel anxious, paranoid, their heart rate goes up. It's very unpleasant, and that can last for hours. So less is more. And if I don't have a choice other than an edible, I usually don't even want people to try to increase their dose for a couple of days until we can really establish how they're responding to it. Topicals are also a very popular way for people to try cannabis, especially if they're feeling reticent about any kind of ingestion or side effects. These are portable, they're convenient, they're easy to use, they don't have any systemic effects, so people don't have any risk of feeling the anxiety, the paranoia, the euphoric effects. They can be helpful for itching, muscle pain, sometimes even neuropathic pain or neuropathy. Topicals can work in about 10 to 20 minutes and last for a couple of hours. They don't penetrate into the skin, so it's very unlikely that somebody's going to get relief from a topical if they have osteoarthritic pain in their knees and their hips and their back. It's certainly worth trying, but sometimes they just don't work because they can't reach deep enough into those areas to get that relief that they're looking for. There are transdermal patches though, and this is something we're fortunate enough to have in the state of California. These cannabis patches are actually designed to penetrate the skin and get into the bloodstream. So unlike a topical, these do have systemic effects. So they can help relieve more generalized things like pain, anxiety, even nausea. A great alternative if we need to try to help somebody with nausea, they can't swallow, and inhalation is just not a good idea. These products are expensive. They can range from $10 to $14 per patch. They last about 6 to 12 hours. Sometimes we can reduce the patch into smaller portions by cutting it into quarters. I even had one patient, I cut it into, I think we did 1/30th of a patch. We cut it into 30 strips. That's how sensitive he was. I like patches though, because you can put it on and not have to worry about repeated doses throughout the day. And if you are having a side effect that you don't like, you can remove it, and those side effects will go away relatively quickly. Okay, So I want to talk about how we use cannabis for different conditions. And once I finish this part, I will have an opportunity for people to ask some questions. I know some of you submitted questions ahead of time, and if I haven't addressed them, I will certainly do my best to address them at the end, but you're welcome to also put any questions you have in the chat or come off once I'm done here. So sleep, definitely an area where we see cannabis helping quite a bit. This is the National Academy of Sciences, Health and Medicine report that came out in 2017. And this report was actually a collection of over 10,000 peer-reviewed studies. And what they did was they reviewed the evidence, and then they came out with their recommendations to say whether or not there was, good evidence, poor evidence, somewhat good evidence around cannabis for these different conditions. This is available for free online. And they found in their research that there was moderate evidence that cannabis can be effective for improving short-term sleep disturbances and not necessarily long-term. They haven't studied long-term, but it was helpful for obstructive sleep apnea, fibromyalgia, chronic pain, and multiple sclerosis. We know that low doses of CBD can be stimulating. So remember earlier on, I said that the biphasic effects of these cannabinoids is that low dosages can often cause one effect and a large dose can cause the opposite effect. This is often true around CBD. If it's not stimulating in low dosages, it's probably also not very helpful for sleep. If we look at the research, the majority of studies that have looked at CBD for sleep have been in the hundreds of milligrams. Often 100 to 300 milligrams is where people will find some benefit. Now, that's not to say that there aren't people that will find benefit at the lower dosages. So starting low and slow usually makes sense so that we don't miss that opportunity to find the dose if it is lower. The challenge, of course, is cost when you get into these higher dosages. I mean, somebody asked me yesterday, if someone had to take 300 milligrams a day of CBD, what would that look like a month in cost? And I said, probably close to $300. And remember, again, that's not covered by insurance. The THC for sleep can often be really effective in low dosages, whereas high dosages can often stimulate people and keep them awake. The cost of a low dose THC product in California can be anywhere from $25 to $100 a month, depending on how much people need. So it's much more cost effective. Of course, THC can have more side effects. It can cause people to have dry mouth and dry eyes, which can be disruptive to their sleep. And often THC over time with long-term use, I'm talking a year or more, people can develop what's called a rebound effect, meaning they can take the THC at night, they fall asleep just fine, but as that dose has worn off, they're now kind of wide awake because they no longer have that THC in their system to continue to help them sleep. Things like tinctures and edibles, even those patches, can be most effective for people who want help staying asleep. And if people are trying to fall asleep and need something to work quickly, sometimes inhalation makes sense for them. And sometimes we're going to look for a product that has more of a sublingual effect or a rapid onset. Those products are sparse. There's not a lot of them that actually are on the market that work. But CBD is marketed as a potential sleep agent, as many other things. I think CBD is marketed as a cure-all, which it's not. And again, these small dosages can be stimulating and not sedating. Now, sometimes when Dr. Ethan Russo, who's one of the better known cannabis physicians who has done a lot of research, his thoughts are that if someone is using small doses of CBD, they may have other things in there that are contributing to that sedative effect. And it's not necessarily the CBD on its own. And as I mentioned, higher doses are often well tolerated, but it can become cost prohibitive for many people to try to get to those levels. Appetite issues, nausea and vomiting. We have some medications that are FDA approved that we can prescribe that have been studied for appetite stimulation. And they're called, the medication's dronabinol, also known as Marinol, or Syndos, which is the liquid form. And this was a drug that was developed, it's synthetic THC. It was developed in the 80s. And what they found was that the THC would, again, activate that cannabinoid receptor that I talked about very early on. And when it activates that receptor, it releases a hormone. And that hormone will actually help increase the food intake. So now you're finding that you're having a little bit bigger portions and maybe you're taking in more calories. It can also help food taste better. I mean, people talk about some of the euphoric effects of THC is increased pleasure sensation. So music sounds better, food tastes better. They think things are funnier than usual. You know, those are some of the side effects of THC. But they looked at using THC particularly for appetite. And this was a small study done with HIV patients. And they found that it not only increased that hormone, as well as it reduced levels of the appetite suppressing peptide. So there was mutual benefit there. When it comes to, and what I want to say back here, I didn't put a slide in here before, but CBD on its own without THC has been shown to suppress appetite. So often people will want to consider CBD for appetite, but it may not be effective and may actually be counterproductive in terms of helping someone if it is in fact suppressing their appetite. We don't usually see appetite suppression unless somebody's been on it for over 2 weeks and in higher dosages. It hasn't been studied as a dietary supplement yet, so I don't know if the research would really demonstrate that you could use it for that, but often ask me. Looking at cannabis for chemotherapy-induced nausea and vomiting, we know that cannabinoids can have a synergistic effect with some of the other medications that you're prescribing, meaning that sometimes people will say, yes, my Zofran is helping or my Compazine is helping, but I'm still kind of queasy, I'm not throwing up. And we've got a couple of studies that have shown if you're taking THC or CBD or even CBDA, that combination will actually enhance the anti-nausea effects of the medication and even reduce the chances of vomiting. So there's no reason that people can't take the two together. Chronic pain is definitely one of the major reasons people come to cannabis, especially in the older adult, right? As we age, some things like arthritis start to catch up with us, and we have less and less options as we age in terms of medications to help manage the pain. We know that cannabis is not toxic like opioids or pain pills and some of these other non-narcotic medications like your ibuprofens, your Tylenol. It doesn't cause constipation. It can exacerbate it, but in general, it's not going to cause the gut to slow down like the opioids will. It doesn't cause any physical dependence. That means that people often in low dosages can take cannabis, and if they stop abruptly, they're not going to have any withdrawals. And side effects are fewer and often controlled by controlling the dose. And there's no lethal dose of cannabis, so you can't take enough to actually stop your breathing or your heart like you can with some other medications. And we've looked at a lot of human studies, and they have demonstrated over and over again, that when patients use cannabis with their pain medications like their opioids, they're reducing their opioid intake overall. So we're calling this an opioid sparing effect. Some patients will start cannabis and find that they may not be able to come off of their opioids, but they can reduce their use by half or more. And some of the side effects from those medications become less as well. So there can often be benefit to using both, and it doesn't have to be an either or. And the National Academy of Sciences also reviewed the evidence around using cannabis for chronic pain in adults, and they found conclusive evidence that cannabinoids are effective at reducing inflammation, modulating pain, boosting the opioid analgesic effects, and shifting the dysphoria associated with pain. We know that CBD can positively influence mood and can shift the dysphoria with pain. It can also lower heart rate and aid in arousal. It will activate additional receptors outside of the cannabinoid receptors, like our serotonin mood receptors. So CBD does show a lot of promise in the way that it may interact with these other receptor systems in our body, but we know that without THC, it often doesn't have much value. I often will use CBD a lot to help reduce the unwanted effects of THC. So a lot of times people will talk about ratios of CBD and THC. I typically don't work with ratios initially unless I have to. I like to start with one cannabinoid at a time so I can evaluate how is somebody responding to it. But CBD works really well as like a dimmer switch on a light. You add it in with the THC and it really can help lessen some of that euphoric effect or lethargy that some people get, or even the short-term memory that people associate with THC. And again, in isolation, CBD may be helpful for mild pain. I'll often compare it to Tylenol, but most patients will need THC to control their pain, and the literature definitely reinforces that. There was an animal study that looked at low CBD, and it really not only helped prevent allodynia, which is like overall pain, it actually also helped decrease the anxiety related to pain. Again, it can help with making those opioids work better so people can take less, they can get better results together. This was a really small study, but it was looking at topical CBD again for the neuropathic pain. And patients found a sharp reduction of their intense pain, the itching, and even the cold sensations associated with their neuropathic pain, which is really promising because, again, topicals aren't going to produce any systemic effects, so you're not really going to feel anything from it. It's not going to interact with your medications, and it's quite portable and quick onset in about 10 to 20 minutes. Anxiety and depression is another area that we're seeing cannabinoids showing some promise, and particularly I think that we're underusing CBD for mood. And I think the reason why is because the studies that have been done looking at CBD, particularly for anxiety and mood, have been in these larger dosages. So people who are trying to self-regulate CBD or THC on their own often may find that they're not getting the results they need because they haven't found the dose that they need. People will use THC for depression, and I want to talk about this for just a little bit because I think this is really important. THC over time can actually worsen things like anxiety and depression, and I'm going to show that in a couple of slides. They did look at a study of self-consuming cannabis patients, self-medicating high THC. They found that 50% of them were using it to help with their depressive symptoms. They also found a study in 2018 that showed that our endocannabinoid system that I talked about in the beginning really plays an important role in regulating our mood. And if it's dysfunctional or out of balance, may be contributing to depression in some people. We know, again, that CBD can interact with many of these receptors outside of our cannabinoid receptors, our serotonin receptors, our pain receptors. So it can also help regulate fear and anxiety related behaviors. And I wanted to put this study in here, even though it's a little out of date now from 2015. What they did was they reviewed clinical CBD studies for anxiety, and they looked at the oral dosage ranges that were anywhere from 15 milligrams to 600 milligrams for these patients. So it demonstrates that there's such a wide therapeutic window for people. Some people are going to respond to that low dose, others are going to need the higher. And that's the good and bad news. So we can still personalize it to help people find what they need to work best for them. Unfortunately, when insurance doesn't cover it, again, it can become cost prohibitive. But the good news out of this study is that it was found that CBD was effective for generalized anxiety, social anxiety, panic disorder, obsessive compulsive disorder, post-traumatic disorder, and even that THC-induced anxiety. Remember, again, I said it's like a dimmer switch. It helps lower down some of that unwanted effect. This was a study in 2019 that was looking at the use of CBD for anxiety as well as sleep. And this demonstrated, again, that biphasic effect. So the low dose, around 25 milligrams, seemed to be the dose that people found effective for anxiety. And 175 milligrams was the dose that they found effective for sleep. Now, this is often where I'll start people is around 25 milligrams to see if they're going to have any benefit. So we can go a little bit quicker to try to find relief from anxiety because, again, CBD is well tolerated. But there are definitely some things that we need to be concerned about when it comes to using THC in particular, especially long-term use, because we do have data to suggest that cannabis can cause anxiety and worsen things like paranoia, hallucination, and even disorganized thinking. I've certainly seen this when I have adolescents who have gravitated towards cannabis because, you know, as teenagers, they're not sleeping, they're anxious, they're not eating, you know, they're struggling and they've started to self-medicate. And what will happen over time is that too much THC will build up in the system, and now they start to have the opposite effect of what they're trying to treat. So instead of it helping their anxiety, it will actually worsen it. And then, of course, they believe that they just need more. And so, unfortunately, it causes this increased use in these patients, and then their symptoms just get worse. We do know in these situations that if we bring people down or even off of their higher dosages of THC, their symptoms resolve generally after about 4 weeks, and there doesn't seem to be any long-term effects. And again, this is just more of the literature that demonstrates that higher doses of THC are going to cause anxiety disorders. Now, some of you might be saying, well, what's considered a high dose of THC? This was looking at people who smoked it in, you know, often in a joint, and it was hundreds of milligrams of THC a day. So in a medical patient, they can be using anywhere from 2.5 to maybe 50 milligrams of THC a day. I don't often see an increase in anxiety in those dosages, but if we do, then we will often lower the dose to try to help offset those effects. The products that are on the market here, especially in California, they're artisanal, and they require people to self-titrate, which can be challenging when we're trying to understand the value and the benefit of cannabis. So it's really important, if you are going to start these products, that you have a journal that you're keeping with the amount you took, when you took it, when you felt the effects, were there any benefits, did you have any side effects? Collecting that information is not only going to give you some feedback on what's going on, it also can help your practitioner if you are able to work with somebody who's helping you with cannabis. So you'll get to your end goal usually faster. And as I mentioned earlier, drug interactions with cannabis are rarely so dangerous that we have to discontinue the use of cannabis. Sometimes it's going to help increase the effects of those other medications. And in those cases, we can actually reduce some of those pharmaceuticals, which may improve the condition overall. I want to give time for questions, and I also want to put this up there if anybody is interested in giving feedback on this. There's a QR code that you can scan with your phone. We will send out these slides if you prefer to use the link to give us some feedback around whether or not this was helpful, somewhat helpful, not helpful at all, or you wanted free samples. Feel free to put that information in there for us so that we can continue to make this better. I will say there was one question that came before the talk, and it was asking about hospice and how do we get cannabis in hospice. I can speak for California, in that in 2022, we did pass Ryan's Law, or SB 311. And Ryan's Law was passed to require institutions that are not mental health or substance use institutions to allow any terminally ill patient. So if you have a year or less to live, these facilities are required to allow a patient to use cannabis as long as it's a non-smoking, non-vaping form. So here at Stanford, we have updated our policy that if patients are coming into the hospital and they've been using cannabis, they are allowed to continue their use. They have to bring it in themselves, or a family member has to bring it in, and they have to self-administer. But these institutions cannot deny them the use of cannabis for symptom management. Okay, looks like I've got some questions here, and thank you so much for sending out that survey link as well. Okay, do you recommend a site to check for interactions with particular meds? I personally like LexiComp, and for healthcare professionals, I like LexiComp because LexiComp will actually list the different cannabinoids, THC versus CBD, with those medications and determine whether or not they think there's a risk of. Sometimes the cannabis will increase the effects of the other medications. Sometimes it'll decrease the effects of those medications. So you can make a determination of which needs to be adjusted, the medication or the cannabis, based on that interaction. And we'll generally see if there's going to be an interaction. It usually takes a couple of weeks because the cannabinoids take a while to build up in the system. Can I provide a list of trusted sources? Yeah, I mean, there's definitely some, maybe I'll put that together and give to Anne that she can send out as well. There are products that I tend to like in the state of California just because I've worked with them for a while and I know that they're solid and they're not going to go anywhere. We're seeing a lot of companies right now kind of go out of business, unfortunately. So for patients who are relying on that, it can be really frustrating to lose access to something that was helpful. Lauren, what other plant contains cannabinoids? Any? Yeah, good question. I don't have my thing with me. I think echinacea has cannabinoids in it. I think chocolate can mimic certain cannabinoids. It doesn't necessarily have cannabinoids in it. The most abundant cannabinoids are in the cannabis plant, and there's over 100 of them that have been identified. But we only really have access to about 6 or 7 at this point in terms of what people are producing for us to consume. Okay, looks like I have. Okay, did I miss anything here? I think I got through all. If anybody wants to come off because they don't like to type like me, feel free to come off and ask me a question. This is truly my favorite part. I don't think there are any bad questions, and often they're questions other people have. So, can excessive use of THC and CBD adversely impact organ function? Yeah, good question. So yes. Again, how do we quantify that dose, right? We do have some data that we've found in animals looking at CBD, particularly on liver function, and it's about 800 milligrams a day CBD in humans, where we would be concerned about it affecting the liver adversely, causing the liver functions to go up. We've seen there's actually an FDA approved medication called Epidiolex. It is a CBD medication that is from the plant. So they grow the marijuana plant, extract the CBD, and reduce it down into an isolate. And it's indicated for certain seizure disorders. The dosing on that is 5 milligrams to 25 milligrams per kilogram of body weight. So we're talking hundreds and hundreds, sometimes thousands of milligrams. And we've seen in those higher dosages some impact on drug-to-drug interactions and liver functions with some of the other anti-seizure medications that can be hard on the liver. So the thing I think, Doug, that is important with this is that if you're on medications that are already toxic to the liver, these cannabinoids could potentially also impact that. I've seen in a handful of patients high THC use, and again, I'm talking hundreds and hundreds of milligrams, where their liver enzymes did go up, and there's some animal data, not in humans, and it's conflicting because some of the animal data says no, THC helps the liver, and then there's others that say no, it's can cause some liver damage, scar tissue. So it's always good to be monitored. Use for peripheral neuropathy, yes, I think cannabis has great potential for peripheral neuropathy. Most of the time, I'm going to recommend people start with a topical because it's really easy to use. It doesn't have any side effects. And there are ways that, you can try it without worrying about getting impaired or quote unquote high. If that's not effective, then you can try an oral product like the drops, the oils, or even an edible. And it depends. I know I don't have specifics, and that's not to be difficult. It's just that everybody's so different. Not all routes of administration, Lauren, are completely cleared by the liver. So inhalation goes through the lungs. It does bypass the liver. Transdermal patches bypass the liver. Topicals don't go through the liver. And we do have suppositories on the market, though I'm not a huge fan of them. Those also are not going to be cleared through the liver. And how about the type of strain used for CBD THC? Let me see here. I think you expand out several different types of marijuana plants. Yeah, so this is where I'll start to lose people because there are thousands of different types of strains, right? So if you walked into a dispensary today, you would see, OG Kush, you would see Obama OG, you would see, the names Gorilla Glue, all these different names, and they don't give you any indication of whether, what kind of medicinal effects it's going to have on you. I'm really looking for the profiles, how much THC and how much CBD is in that product or in that plant, and using that to determine the dosage for the patient. So it's really overwhelming if you walk into a dispensary. I mean, not just because sometimes the smell can be overwhelming, but also the amount of products and, where to start. The way that they process the plant can make a difference. And that's a little bit more of an advanced talk for today. But yeah, I mean, just in general, I would say it can definitely impact how people feel. I think that was it from you, Sarah, it looks like. But that's the end of the questions. I know we're coming up on the top of the hour, and I just want to thank everybody so much for being attentive and great questions. Thank you so much. I appreciate it. Very thoughtful. And, if you liked it and you want to see it again, let us know. If there's another area that you want to see on this topic, please let us know.
I have a question. How do we get a referral from our oncologist to you or another person that prescribes at Stanford? We are with a Stanford oncologist.
Oh yeah, great question. So have them refer to Palliative, Outpatient Palliative. To me specifically right now, I would say I am the sole palliative care provider that will, we have some in our department that are familiar with cannabis, but if you've tried it and you didn't have much success, ask for me, Eloise, Theisen, in the referral. And I'm booking about a month out, but yeah. That's
which campus are you located at? Are you in South Bay or?
I'm here, there, and everywhere.
Okay. And do you do video appointments?
Yes, I do. Yeah.
Thank you.
Yeah. And Lauren said, please specify that it's for cannabis when you have the referral sent over.
Okay.
Yeah.
Good to know. I appreciate it.
Yeah. It's really probably a career highlight for me to be able to offer this to patients now in this setting. So if you're in the Stanford system, ask for a palliative care referral. We'll be happy to help you.
And is it easy to get? Or do some of the oncologists balk?
I don't think so. Lauren, do you have any comments on that? She knows a little bit better than I do. I haven't seen that. Maybe if she gets a chance. No balking.
Good to know.
Good. Thank you.
Thank you. That neuropathy is a real problem.
It can be, yeah. So hopefully I'll get to see you guys soon and help you with that.
Good. Thank you very much.
You're welcome.